Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, in this video we can see the questions for exam and we'll see today's questions one by one. First question, measles vaccine is a. This question was asked in ESI exam 2009. We can see the options. Option A, live viral vaccine. Option B, live bacterial vaccine. Option C, killed viral vaccine. Option D, killed bacterial vaccine. So here question is measles vaccine is an example of. So measles vaccine is an example of live viral vaccine. So measles vaccine is one of the example of live viral vaccine. We can see what are the vaccines coming under viral vaccines, live viral vaccines, that is OPV, yellow fever, influenza and measles. MMR vaccine. MMR vaccine means mumps, measles and rubella. These all are live viral vaccines. And we will see other live bacterial vaccine. We can see that is BCG, typhoid, oral typhoid vaccine and plague vaccine. This is an example of live bacterial vaccines. So live bacterial vaccines include BCG, oral typhoid and plague. And we will see killed viral vaccine. We can see killed viral vaccine. Examples: rabies vaccine, sac polio vaccine, that is injectable polio vaccine, hepatitis B vaccine, Japanese encephalitis vaccine. These are all some examples of killed viral vaccine. And killed bacterial vaccines include typhoid, cholera, pertussis, meningitis are example of killed bacterial vaccines. Okay. So here our question is measles vaccine is an example of live viral vaccine. And next question, second question, according to ICMR, the daily intake of calcium for adults should be, and the options are option A 300 milligram, option B 600 milligram, option C 1000 milligram, option D 100 to 200 milligram. Question is, according to ICMR, the daily intake of calcium for adult, age group is adult, and the correct answer is option B 600 milligram is the correct answer. That is the daily requirement of calcium for adult is 600 milligram. And we can see the different another age group for infant it is 500 milligram. That is daily requirement of calcium for infant is 500 milligram. And calcium daily requirement of calcium for pregnancy it is 1000 milligram. Lactation also 1000 milligram. So adult 600 milligram, infants 500 milligram, pregnancy and lactation 1000 milligram. This is very important question. Any one age group can ask us a question. Okay, and the main sources of this calcium include milk and milk product such as cheese and curd, egg, fish, green leafy vegetables and cereals are the some of important sources of this calcium. And the main functions of this calcium include formation of bones and teeth, blood coagulation, muscle contraction and also cardiac function. Also calcium is necessary, and the deficiency of this calcium cause tetany, mainly tetany and convulsions, growth, defective growth of bones and teeth all occur. Okay, here our question answer is option B 600 milligram for is the daily requirement of calcium for adult. Next question, the third question, while cleaning the eye should be clean from. This is the question, and options are option A inner canthus to outer canthus, option B outer canthus to inner canthus, option C middle of the eye to inner canthus, and option D all of this. So doing eye care, the eye should be clean from where to where? That is the question. The eyes are clean from the inner canthus to the outer canthus. Okay, so option A, inner canthus to outer canthus is correct answer. Why we are doing this is to prevent the particles and fluid from the draining into the nasolacrimal duct. So the fluid, while cleaning, that fluid and dirty particle, fluids and particle from draining into the nasolacrimal duct. Okay, so we have to clean inner canthus to outer canthus during the time of eye care. Also, during eye care, we have to use separate cotton or separate washcloth for each eye. This also prevents spread of infection from one eye to another eye. Okay, here our question answer is option A, inner canthus to outer canthus. And we will see the next question, fourth question. Next question, fourth question, stiffening occurs in the body after death is known as. And the options are algomotives, option B levomotives, option C rigomotives, and option D none of this. Here question is stiffening occurs in the body after death is known as rigomotives. Option C is correct. What is rigomotives? Rigomotives is stiffening of the body after death is mainly due to fixation of the muscles. Okay, is due to fixation of the muscles in the body, and this rigomotives generally appears within few hours after death. Okay, it first involved in the muscles of the jaw and then successfully passes down to the neck, arms, trunk and legs. So rigomotives first involves in the muscles of the jaw and then it passes to the neck, arms, trunk and legs. So rigomotives means is the stiffening of the body after death due to the fixation of the muscles. Here option C is correct answer. And the remaining options, algomotives. Algomotives means is the cool death, that is cooling of the body after death is known as algomotives. And the next option, option B, levomotives. Levomotives means is the discoloration of the skin after death, that is bluish to purple discoloration after death is known as levomotives. Okay, here our answer is option C, rigomotives. Question, the fifth question, a specific mask used for preventing H1N1 is. Option A, Venturi mask, option B, rebreathing mask, option C, HEPA mask, option D, face mask. Here, special mask for H1N1 is, answer is option C, HEPA mask. Okay, HEPA, HEPA mask. The full form of HEPA we can see, high efficiency particulate air or filter. Here, high efficiency, H is high, E is efficiency particulate air mask, that is mask used for preventing H1N1. Okay, and the remaining Venturi mask and rebreathing mask are the example of oxygen mask. Here our answer is option C, HEPA mask. Next question, communicable period of measles is. Option A, after 4 days of rash. Option B, 4 days before and 5 days after rash. Option C, throughout the disease. Option D, only in incubation period. Here question is communicable period of measles is, that is the question. So measles is also known as rubella and the causative organism for this measles is RNA paramyxovirus and the incubation period of this measles is 8 to 12 days. Our question is not incubation period, our question is communicable period of measles. When is the communicable period? Maximum spread of infection. Okay, and the mode of transmission is droplet infection. That is measles is transmitted mainly by droplet infection. We can see the communicable period, that is in measles The period of communicability maximum in 4 days before and 5 days after appearance of rash. Okay, so the period of communicability is 4 days before and 5 days after appearance of rash. Okay, that is here option B, 4 days before and 5 days after rash is correct answer. And another one important point, the communicable period of chicken pox we can see, that is in chicken pox 1 to 2 days before and 4 to 5 days after appearance of rash in case of chicken pox. Okay, 1 to 2 days before and 4 to 5 days after appearance of rash in chicken pox. And in rubella we can see the communicable period, that is 7 days before the symptoms to 7 days after the appearance of rash in case of rubella. Okay, here our question is communicable period of measles. It is 4 days before and 5 days after appearance of rash. Option B is correct answer. Next question, the seventh question. Pleomorphic appearance of rashes are the characteristics features of. That is the question, and options are option A measles, option B smallpox, option C chickenpox, option D diphtheria. Here question is pleomorphic appearance of rashes are the characteristics features of. Among this chickenpox will come correct. Okay, option C is correct, chickenpox. We will see the causative organism of chickenpox, that is the causative organism of chickenpox is varicella zoster, and the chickenpox is also known as varicella, and the incubation period of the chickenpox is 12 to 14 days. Causative organism is varicella zoster virus, and the mode of transmission of this chickenpox is droplet infection and droplet nuclei. Here out, and the main symptoms of this chickenpox is mild fever, mild or moderate fever, backache, anorexia, shivering, malaise, all the rashes or the symptoms of this chickenpox. And our question is pleomorphic appearance of rashes. About the rashes we can see in chickenpox the rashes are centripetal, axillary, mostly on the flexure surface. Okay, and the peculiarity of this rashes is superficial, unilocular and pleomorphic rashes. So this is an important point. Superficial, unilocular and pleomorphic rashes are the characteristic features of chickenpox. Okay, and the mode of spread or evolution of the rashes is very rapid in chickenpox, and the rashes appears on the chest. Firstly the rashes appears on the chest, back and the face. Okay, so first rashes appears on the chest, back and face, and then over the entire body including mouth, eyelids and genitalia. Okay, these are all the some important points regarding this chickenpox. Here our answer is option C, chicken. Next question, eighth question. Removal of the large skin wrinkles and folds from the face and neck is known as. Options are option A rhytidectomy, option B blepharoplasty, option C rhinoplasty, option D abdominoplasty. Here large removal of large skin wrinkles and folds from the face and neck is known as rhytidectomy. Option A is correct answer. So what is rhytidectomy means? Rhytidectomy is the removal of large skin wrinkles and folds. Here face and neck is called the rhytidectomy. And the another one option blepharoplasty is there. Blepharoplasty means plastic surgery of the eyelids. Okay, blepharoplasty. And the next option rhinoplasty. Rhinoplasty means is the plastic surgery of the nose. And abdominoplasty means removal of excess abdominal fat is called abdominoplasty. Here our question is removal of large skin wrinkles and fold from the face and neck is called rhytidectomy. Option A is correct answer. And we'll see the next question, ninth question. Most common type of skin cancer is. Options are option A basal cell carcinoma, option B squamous cell carcinoma, option C malignant melanoma, option D none of this. Here question is most common type of skin cancer. Okay, we will see the answer. Basal cell carcinoma is the most common type of skin cancer. So option A is correct, that is basal cell carcinoma, that is the most common type of skin cancer, and whereas squamous cell carcinoma is the second most common type of skin cancer. So second most common type is squamous cell carcinoma and the first most common type is basal cell carcinoma, and malignant melanoma means is the cancerous tissue of the melanocytes. Okay, here option A is correct answer. Next question, the 10th question, deficiency of vitamin C may cause. Options are option A scurvy, option B pellagra, option C beriberi, option D pernicious anemia. Here question is deficiency of vitamin C may cause. Answer is option A scurvy. Vitamin C is also known as ascorbic acid. So deficiency of vitamin C or ascorbic acid may cause scurvy. And pellagra. Pellagra is due to the deficiency of vitamin B3 or niacin. Okay, that is called pellagra. Pellagra is characterized by 3 Ds, that is dermatitis, dementia and diarrhea. And another one option beriberi. Beriberi is due to the deficiency of vitamin B1, that is thiamine. And pernicious anemia is due to the deficiency of vitamin B12 cyanocobalamin. Here our question is deficiency of vitamin C may cause scurvy.